IEP Urgent Care, Dr. Brian Kim and Dr. Peter Bullach. Welcome to the show.
Welcome.
Thank you.
Thanks for having us.
Welcome back to Brian, but first time here.
First time here. A little
Well-
nervous, but I'm
Oh, don't be nervous. Now, I've seen you before because
Sure.
I have frequented IEP. Now, you guys were just, and still going on, but just amazing during the COVID testing season, I'm calling it, when, it seemed like school was out, school was in. Sports were out, sports were in. You need to have a COVID test to play.
right. Sure.
How'd you guys keep up with all that?
A lot of hard work.
Yeah.
Yeah, a lot of hard work. But we have a good system, good team in place. So that's the main thing. I mean, I can't do anything without my support team. So,
Brian, when you opened in Jackson, you had a good idea it was going to be successful, but I got to believe it's been wildly successful beyond your dreams.
It has been, but it's also been, it tells you that there was a need in the community for an urgent care to service. And unfortunately, we had the pandemic as well. And when other places were closed, we had, with Peter and the leadership team at the urgent care, to open up those slots to fill the needs of the people, to get the COVID testing, just to be checked out where other places were closed or not being able to accept patients.
Yeah, and I think the fear people had of going to the hospital. And I know you were very worried about that because some serious conditions might have been undiagnosed.
We were, as we talked about previously, we wanted to direct people to places that could serve their needs immediately, which was our urgent care. And then for others, we wanted others to come and not wait for their emergency care. And so I thank you guys for spreading that message because it was heard loud and clear.
That's great. What level of care should someone go to IEP for? You have conversations all the time. Should I go to the ER? Should I go to IEP Urgent Care? Which is it?
I think Pete's best at it.
for this.
Yeah.
Well, we're a full service urgent care. We can take care of just about anything in our clinics. We have full x-ray, full testing capabilities, obviously for COVID. Now we have rapid PCR testing that's available to our patients. They get a PCR answer in 30 to 40 minutes, especially for travel and things. That's very effective.
Raise your hand if you've been to IEP Urgent Care.
Everyone in my family has, and I want to say that this level of care is amazing. The staff is so nice, and I was in there with my daughter, and you have a lot of kids getting COVID tested,
Sure.
nervous, but your staff really makes people feel comfortable, and I felt like they went out of their way to make sure my daughter felt like she was okay and joking around, and it was just a really good environment.
I want, our vision has always been to have a place where people felt comfortable. And so when you asked about the question, where should they go, to the emergency or to the urgent care? Sometimes if they go to our urgent care and it turns out to be something a little bit more serious, that's where that patient journey is always important, where Pete's team calls us, we have that golden ticket as we talked about, and we're waiting for them to come and arrive so we can put them in a room quickly so they don't have to wait.
That's a good point because there are urgent care facilities in every community, just about. How do you know? What's the difference between yours and other urgent care type practices?
We closely work with the hospital. It's our partnership. We've been here since 2008. As a company, we've been here for 25 years. We're celebrating our 25th anniversary this year. And this has made, our vision has always been this patient journey. We've been able to expand our services outside of the four walls of the hospital to provide that care. So urgent care is one arm of that journey. And we know that if you were to come to an urgent care that was not affiliated, then they tell you to go to a hospital for your care. There's always that inherent delay and always repeating that story over and over again while you're there. We always wanted to make it streamlined, so it's always customer, patient friendly, as opposed to just not any other businesses probably that just consider you one step. We want to complete that journey for the patient because any health related issue is such a worrisome for the individual as well as the family.
Yeah, I was going to say, I mean, you don't realize that most of the time your patients are under a large amount mental stress
Yeah.
and physical stress, so that level of care is certainly important.
You're fairly new with IEP Urgent Care. Peter, tell us
That's
a little
correct.
bit about your background.
Well, my background, I started in family medicine, done about 12 and a half years, private practice, very successful. I have 3 sons. I was never home, never saw them, so I transitioned over to urgent care, and I started here in Jackson back in December of 14. The company that used to be here, Med Express, and when I had the opportunity this past January to join with IEP, who I had known for years back in my time in primary care, because I was on staff at the hospital, so I admitted, and I used to talk to these guys all the time at 2 in the morning for different things, waking me and my wife up. But that was part of my
Who
job.
would have known that
Yeah.
all our calls drove you into this world?
Yeah,
Urgent
exactly.
care.
Yeah, you drove me. You didn't know it years ago. So I've had the opportunity to join IEP back in January. So I was very pleased and happy with that opportunity, and to stay in Jackson. It's like a second home now to me. So
Nice.
Very
And
happy,
that
yeah.
Med Express, they were briefly here. They pulled out of the state.
yeah, they pulled out of the state for sure. So.
How about the location right across the street from the hospital? Talk about how that's worked out. Obviously, the golden ticket to the ER, and how that works is if the doctors at IEP, they're emergency physicians, they know if someone needs to go to the ER. So it is a golden ticket. Talk a little bit about that process.
Well, the location has always been the key, and we've been very blessed to have that location, and that proximity to the hospital has been such an amazing thing. So that process, if you come to our urgent care, and if Pete sees you there and thinks that the condition warrants a little bit higher need of testing or whatnot to be provided from our hospital here in Jackson, their team will call us and we will have this golden ticket ready. The process from the ED is that we will notify that registration as well as our nurses that when that patient arrives with your name, that you're expedited through, because obviously if you're going to someplace, you don't want to be delayed in telling that story. So it's worked out well, but also in a sense, I think we haven't had the need for that frequent golden ticket because of Pete's team and how wonderful a job they did. There's a story that we had shared a couple days ago where someone said, wow, there's not a lot of ED visits. ED visits are lower now. And so one of my partners had told somebody, not at this location, but another, that we do such a great job. They don't need to come to the ED.
Right.
So I attribute the number of golden ticket referrals that is very low to Pete's team being able to treat it very well and successfully well.
Yeah, well, you don't want a golden ticket.
No.
If you do get a ticket, you want the golden one, though.
Yeah, that's right.
Exactly. Because it is nice because we know each other. So when
Yeah.
I call to the ER, they know how I practice. I know how they practice. So
It's a
just a
partnership.
trust
Yeah.
thing as well. So yeah.
IEP Urgent Care opened in the midst of the pandemic. I remember the open house. It was social distance, masks. It was everything with all the precautions. But we're still seeing cases, and you're still testing people. What,
Yeah.
from your standpoint, what's the state of the pandemic?
We're in a lull right now, and thankfully so. I can't imagine what number we are, what way we are, but the lull is in tribute to also the number of people that have increased their vaccinations, as well as the booster, and I think it also has to do with those that were reluctant to see what kind of effect it had for family and friends, or maybe themselves personally. I'm praying that this is, quote, the lull will continue on as a lull, because I don't think COVID's ever going away. Well, it's a wait and see. I'm just very hopeful. I do think that the lack of people, the less cases allows more people to have interactions with one another, which we didn't have because of the isolation. And I think we are all better for human interaction as opposed to isolation.
Yeah, absolutely. More with Dr. Brian Kim and Dr. Pete Bullach from IEP Urgent Care after this quick break.
With proper alignment, your vehicle's tires can last a lot longer. At G-Force Automotive, we perform a comprehensive front-end inspection and perform a complete alignment on your car, truck, or SUV. We'll keep you driving straight down the road. At G-Force Automotive, we make friends one car repair at a time.
Improving the air quality in your home isn't a luxury, it's improving your family's lives. Our staff do each job carefully, completely, and with great attention paid to you, the homeowner. We take care to leave each home better than we found it, and when you take your first breath after one of our cleanings, I'm sure you'll agree. We can help keep your home cleaner and your air safer by scheduling a cleaning today. Ducks, we're your indoor air professionals.
The PIC Center is an independent practice that has provided care to the Jackson area for over 25 years. Doctors O'Neill and Cack supervise antibiotic infusions, as well as those for many other conditions, such as inflammatory bowel, joint, and lung disease, anemia, and multiple sclerosis. Our modern facility is open 7 days a week, and the infusion staff will make you feel right at home. Let your doctor know you have a choice where you receive your next infusion. Remember, when you've picked us, you've picked the best.
It's kindergarten and young fives roundup time at Jackson Public Schools. Join us at one of our April roundups. There will be prizes and food. Community partners will be available to serve you, and new students will receive a free Class of 2035 t-shirt upon enrollment. Please arrive early as programs will begin promptly. Jackson Public Schools, where community comes together.
At Consumers Energy, we believe change is empowering, powering both your home and your business. Change is progress, with a modernized grid that can detect outages and restore power within seconds. Change is reliable. We're talking preventing over 35,000 outages last year reliable. And change is enduring, like our dedication to keep your power running, just as it should. Consumers Energy, a force for you, a force of change.
Welcome back. We're with Dr. Brian Kim and Dr. Peter Bullach from IEP Urgent Care this morning. And sports physicals. Do you guys do sports physicals?
All the time.
Oh my goodness.
Yeah, now's the time.
Yeah, now's the time. Now is the time. Do you remember when we used to have to get sports physicals?
It was a scramble.
It was a scramble.
Oh, for sure.
It was a scramble.
It's hard to get in. And it really is. That's one of the things is a lot of people wait till the last minute. The coach says, oh, by the way, you're not putting the uniform on until you get your physical, and it's tomorrow. So you've got hours that are, of course, longer than a doctor's office.
Oh, sure.
What do people need to know before they come in? Do they have to have certain insurances? Are there specific insurance companies you work with? Do they have to have insurance?
Well, we accept pretty much all major insurances, take Medicare, including Molina. We even take cash paying patients, obviously. We have a setup for that as well. Sports physicals, we can get them in 8 to 8 all day. Really don't need an appointment, just walk right in.
You can actually set up your appointment
online as well, yeah.
Which is what I did.
Yeah,
for sure.
it's great. And,
Sure.
If it's something that's maybe a non-emergency, which a
Sure.
lot of things are, you
Sure.
maybe make it later in the day or the next
sure.
day. So it's a great system.
The great thing about is in our partnership with the hospital and the Jackson Health Network is this the electronic chart. So things that are done there is able to be communicated to your primary care physician through Epic, and so that's something that is unique that hasn't been done before here. So make sure you don't have to repeat the story again to your primary care physician.
Yeah, the MyChart, the whole system is awesome. I hope everyone is part of it. If you aren't, you should, because it's your healthcare in our community, and it's all there. And
It's amazing what people did before that, really.
Yeah.
I mean, it's amazing.
I write to my doctor all the time.
He loves you.
Now, I can't get over that UCLA Bruins lanyard. It tells me you're getting ready for the NCAA tournament. Dr.
Yeah, I am hopeful that they will do well in the tournament. I graduated from Loyola from medical school, so I was very excited a couple years back, pre-COVID, when they made that run, and so we'll see how they do as well.
See if we can get you a Sister Jean autograph.
Yeah, I know, right? Or a bobblehead.
Yeah.
Well, and they're on opposite sides of the bracket, so they could face each other in the championship game.
Rightfully so, Bart.
I have both Loyola and UCLA going pretty far.
On your
Yeah, on my bracket. Do you guys do brackets?
I don't. My colleagues do, though. I get disappointed sometimes. But that's what makes it fun, because there's upsets, and that dream is kept alive, which is great.
What's your school?
Michigan State, big Spartan fan. Yeah. So.
Green, wearing green today, too.
Yeah, we've got a lot of Spartans in the building.
That's right.
A lot of
St.
Spartans in
Patty's
the
Day's
building.
tomorrow.
Yeah.
I've got them. Your mom's got them going all the way to the championship game.
So I think you guys have really done a great job in making this community safer and healthier. And just want to thank you guys. It's been, from my personal experience, it's just been great. I think I was probably there 4 times in the course of a year, and no stress, really no stress. So thank you.
Well, it's our pleasure, our privilege, really.
Yeah.
You get to choose to come to us.
Absolutely.
I mean,
I've been there a couple times myself, and it's nice. It's nice to know it's there, and it's super clean, super professional, and you guys do a great job. Thanks.
Thank you.
Well, thank you.
We got
We
you
do have
guys
some
some
gifts.
things.
Yeah.
Swag bags
These are
for you
nice
guys.
Swag bags. I've
Yeah.
never
Nice.
seen, guys. Thank you.
Oh my gosh, there's a lot of weight to this.
Oh wow.
All the IEP bells and whistles.
It does.
So I'm going to pull
Mugs
this out here because of how nice this looks.
The money's in the inside pocket.
I love it.
that's nice.
Can I tell people I'm a doctor?
Oh, absolutely.
Yes, thank you. This is very cool. Thank you guys very much.
Thank
You're
you
welcome.
for
Thank
having
you.
us.
Thank you so much.
Dr. Brian Kim and Dr. Peter Bullach from IEP Urgent Care. More of the morning show coming up next. George Pearson from Howard Hanna. Stay with us.